This is Jennifer Hankey with Organic Baby University and here at Whole Pregnancy. This is an excerpt from the interview with Dr. Sears, pediatrician and author of the vaccine book, where we talk about common arguments between the pro and anti-vaccine groups on the internet. Well, let's talk about a little bit of some of the arguments I hear on the internet. And one is that vaccinations really didn't reduce these diseases, that clean water and sanitation and better medical care is what caused that, and that other countries dropped their diseases dropped to the same percentages at the same time, and they didn't even have vaccinations. So is there any validity to that argument?
I actually don't believe that argument. I do believe vaccines have been the primary factor in reducing and eliminating these diseases. The reason I say that is the rates of diseases, of vaccine-preventable diseases, have almost nothing to do with hygiene and cleanliness and sanitation. There are some diseases that do depend on those factors. But for the most part, things we vaccinate against don't depend on that at all. Chickenpox, infant meningitis, whooping cough, rotavirus, the flu, measles, mumps, rubella, hepatitis B. All these diseases we're actually at steady rates, in our population. They're just part of our society, and they were not in declining for the most part. And then you even look at modern life. Chickenpox didn't decline until we started vaccinating. Infant meningitis didn't decline. Whooping cough didn't decline. In fact, it's now going up. Many of these diseases did not decline until the vaccine started. Now, the way people present this argument, some people will try to show statistics that demonstrate diseases were declining before we started vaccination, and it was because maybe a better health care or better cleanliness. What did decline, and then people are true to some extent in that what was declining before vaccines was fatalities from these diseases. As healthcare improved, as our standard of living improved, as our health and our immune systems and just our day-to-day standard of living has improved, yes, fatalities from these diseases has gone way down. And you take polio, for example. Polio was just going along at its own sort of typical rate. We got much better at healthcare. They developed the iron lung machines to keep people alive while polio ran its course. So fatalities dropped dramatically before the vaccine was there. But the rates of diseases were barely dropping. It would fluctuate. It might have dropped a little bit, but for the most part, it kept going until the vaccine came out. Then you saw both the rate of the disease and the fatalities from the disease drop from the vaccine. And so it's really two different situations. Whenever you see somebody show you data that demonstrates, that shows like a bar graph and the line goes way down before the vaccine.
Right.
Usually that line that's going down is fatalities from the disease because our healthcare improved. Ask somebody to show you data just simply on the rates of the disease, you usually won't see it go down until the vaccine came along. And that's why I do think vaccines are the primary factor involved in eliminating these diseases.
Well, and that's one of the big things you read that's very confusing for parents is you see the CDC website and they have, vaccine, introduced here, and then there's this dramatic drop. And then you read the anti-vaccine websites, and it's the dramatic drop, and then, this is when the vaccine was introduced, and you're like, how can this be that they're having such different results? It either was one or the other. So that helps a lot.
And if it is true, if it's true in one or two situations, it very well may be true in one or two situations. But if you look at every single one of the 15 or 16 diseases that we vaccinate against, is definitely not true for the vast majority of those diseases.
Okay, that's great to clear that up, because that is very confusing to parents, and they don't understand how there could be two different charts for the same information. It's either one way or the other. You clarified so much for us. I appreciate it so much on all these different questions because there's so much misinformation out there, and parents just want to know what the truth is so they can make the best choices for their child. So thank you so much for joining us today.
Oh, you're very welcome. I'm glad to be on.
So thanks so much for joining us.
Right, you're welcome.
Bye bye.